What's up, y'all? This your girl Tay.
And it's your boy Twice. Welcome to another episode of the Facts and Feelings Show.
So today we're going to be talking about mental health crisis. This is our episode number 11. So y'all just tune in, share this out, and we'll be right back with that intro.
I wonder if it's facts or feelings that you're feeling. I don't know if you know what's for real. Baby, just relax and chill. Let the tea spill. I bet the chemistry stop the bill. I wonder if it's facts or feelings that you're feeling. I don't know if you know what's for real. Baby, just relax and chill. Let the tea spill. I bet the chemistry stop the bill. I wonder if it's facts that you feeling. I love the fact you chillin'. These hours fly by when you and I is chillin'. These hours fly by, feel like a couple minutes. Seen you on my timeline. Hold up, wait a minute, Twice and Tay. Yeah, you know they always catching up. Keep us up to date, cause it's hard to keep up through the day.
This your boy Twice.
This your girl Tay.
And as Tay has already said, we got a special guest with us today that we'll bring in shortly. Just wanted to get this podcast started. I think Tay got that fact and them feelings that we normally give y'all at the top of each podcast.
All right, y'all. So we're going to be talking about mental health crisis. And the fact of the matter is, sometimes we have situations where we're dealing with crisis within our homes and within the community, and we don't really know what to do or how to handle those situations. We've seen horror stories on TV about, the police coming out and, potentially harming our loved ones because they don't know how to interact in those crisis moments. But we got a special person on here that's going to come in and help us, because the feelings that we have about this is we need to be educated as a community to know what to do when we are facing those crisis situations.
That's right. So what we're gonna do, we won't wait any longer to bring our guest in. We're gonna add her to the studio right now. We'd like to welcome Miss Jamie Evans. How you doing today, Miss Jamie?
I'm fine. How are you?
Doing well, doing well.
All right. So, Jamie, we are so glad to have you on. We know you've been working in mental health for a long time. You all educated and everything, got all them ABFGs behind your name. So we just glad come in and educate us on what to do when we're experiencing like a mental health crisis. But before we,
Right.
too far and we get to talking about something that you're a little bit more knowledgeable on, can you just tell us like what is a mental health crisis? Because many people may not know what you should consider a mental health crisis.
Right. So we consider a mental health crisis or a mental health emergency anytime that your stressors are outweighing your ability to cope. Meaning, if you're going through something and you are not able to deal with it, you can't navigate through everyday life. Anytime you're homicidal or suicidal, or if there's a situation where you feel like you just can't take anymore, we consider that a mental health emergency. And we want to respond and do whatever we can do to help the individual in crisis.
Oh
Okay,
man.
that's good. I know you said when they feel like they can't cope. So what does that mean? Are you meaning like can't cope in life, can't cope in the home, or what?
I mean, exactly both. If it's a situation where you feel like you can't cope with life anymore, sometimes we hear people say that, hey, I just don't know how to get through this. And that can escalate easily. Sometimes not being able to cope at home with things that's going on can escalate very quickly, and we end up with someone who has potentially felt like they wanted to complete suicide or die by suicide. So if we can get ahead of that and help that individual to learn some coping skills and navigate through that crisis, that's what we want to do.
Cool. Thanks for the information. I'm just sitting here thinking, like, just being honest, just living in Jackson, sometime when we're in certain parts of the city, we may see just something as simple as somebody having a conversation with themselves and other things going on. And we never really know when anything is going to pop up. So now at this point where you've let us know what a crisis look like, what a mental health crisis look like. And just for the viewers, we are doing this because it is Mental Health Awareness Month. So we felt like this would be an awesome topic to share. We're going to share different things all month. But now that you've explained what a mental health crisis does look like, Ms. Evans, let's just say if I see something going on, how can I help? Once I realize that this may be a mental health crisis, what can I do to help?
So right now, if you're located in Hinds County, we have a mobile crisis response team. That team goes out and we respond to mental health emergencies in all of Hinds County. We respond 24 hours a day, 7 days a week, 365 days a year. I do want to clarify, just because you see someone responding to hallucinations or talking to themselves, that may not mean that they're having a mental health emergency. That can simply mean that, hey, they may be schizophrenic and their symptoms are not managed well right now. I want to clarify that a mental health emergency is an instance where we feel like that person is in imminent danger or a threat to themselves or someone else. So, a lot of times we have family members call and say, well, my brother is talking to himself and he's schizophrenic. Well, that doesn't constitute him having a mental health emergency. It may just mean that his medications need to be managed, or, we need to get him in and see what's going on with him. If you are in the community and you see someone who may be experiencing a mental health emergency, anyone can call our crisis line. The only thing that we do ask is, if you're calling the line, be there when we respond, because you can tell us, hey, it's a gentleman on Ellis Avenue with a white t-shirt on running in traffic. We don't know who that gentleman is when we get there. So we would like the person who's calling to be present when we get there. Mobile crisis response everywhere. So we respond to the prisons, we respond to the hospitals, we respond to the unhoused population. We respond anywhere a crisis takes place. We respond in the school district. So we're here.
Okay. That's really good information, and I know a lot of the information that you would be able to provide us is based off of like the Hinds County areas in Mississippi. Is there like any like additional information that you might be able to share with people that may be like on a local level or more, I guess like nationally expanded area for individuals who might be dealing with someone that's in a crisis situation?
I'm going to say 988. 988 is the 911 for mental health. I just posted the other day that, we often teach our children to call 911 if it's a fire, if they need police. We now need to teach our children to call 988 if you're having a mental health emergency, because 988 will actually send you to the mobile crisis teams in your community.
Oh wow, okay. So that's nothing that's just local for like Jackson or Hinds counties. Wherever you at is 988.
Right, 988 is a national number.
Okay, that's
I
good
love
to know.
that. Can I ask a quick question about that 988? Is that
Yeah.
something that you can also like text, or is that
You
only
can
okay?
so, I'm sorry, you can text with 988 as well.
Okay,
Okay.
awesome.
Man, that's huge information. That's something that I think, even if anybody is on this podcast listening right now, I think that's something you should maybe go to your social media pages and just share that out. Because I was familiar with the 988, but I honestly don't believe I knew that you could text that number. So sometimes it may be something going on you don't want nobody to hear that you're calling help for this particular situation. So to know that, you don't want to alert the person that you might be calling somebody to get them help, to know that you can text that, I think is huge.
Yeah,
Right.
it is. So even if a person is suicidal themselves, they can also call or text the 988 number for themselves, right?
Right, they can.
Okay.
Right.
And 988 actually also has a prompt for veterans. Um, so I think that's key too, because sometimes veterans only want to speak with veterans.
Mhm.
Okay. All right. So I think when I was listening to you kind of talk about how sometimes we see individuals that are out in the community that they may be having some like auditory hallucinations, where they're, maybe talking and also talking, answering themselves. Uh,
Right.
Sometimes people feel like, I need to call somebody for this person. But I think it was very clutch when you mentioned that that's not a crisis situation. That's like something, unfortunately, that we see not just in Mississippi, but across the country as a whole, where there's some people that may have at some point, become non-compliant with their medication, and just not having those support systems in place to kind of give them or help them get the resources that they need. So I know you gave us some information about the 988, but if somebody is in a position and they feel like their family member is having a crisis and they contact 988 or they contact, you all where you work, and they come out, are they gonna like automatically take that person into care?
So no, and with mobile crisis, when we come out, we actually provide an assessment. And after we provide that assessment, we determine if that individual is in need of a higher level of care. If it's a situation where that individual is homicidal or suicidal and we know that weapons are there, we may respond with CIT officers. These CIT officers are officers, law enforcement, who have went through a 40-hour training and they're trained how to respond to individuals with mental illness, which I think is an awesome asset for us. Um, our primary goal is to limit the interaction that individuals with mental illness have with law enforcement, just because sometimes their uniform can be a trigger. So
True.
we want to be there in between. And we only use the CIT officers when we have no choice, or as I said, we feel like weapons are there because we don't respond with weapons. We only have our mouth and de-escalation skills. So, we have to make sure we protect ourselves and the consumer.
Awesome. And I just want to applaud y'all. Thanks for asking that question. I want to applaud y'all for all you do because as you shared a little while ago, uh, man, y'all cover a large scope. Y'all go out to a lot of different places when that phone ring. And like you said, we're dealing with mental health. So unfortunately, when somebody is having a some type of mental breakdown or a situation, they're not in their right mind. So you have to be careful. You're there to help, but you got to protect yourself as well. So salute for all y'all do. I think I'm still want to take questions right here. Uh, are there situations when a person may call for a crisis specialist or individual to come out and you think you just asked that, huh? And they not be taken in for treatment? So yeah, you asked that one. So
What but
And if
what would kind of constitute them not taking them in?
not taken, yeah.
so if they're coherent, if we're called and on the phone, mom says, "Well, hey, he's punching holes in the wall and he's combative and he's just out of touch with reality," and when we get there and assess, we do something totally different.
Mhm.
We're
Right.
not, after our assessment, we're not going to take that individual in. We may schedule, it's our goal to schedule an appointment for them to bring them in, and we want to engage them in services. But we're not going to hospitalize anyone just because
Right.
the family wants them hospitalized or the
Mhm.
family is uncomfortable.
Mhm.
And what you saying that I remember when I worked in mental health, I know it was times that someone would be called, and I just remember going to St. D. Sometimes people would be taken to St. D, and when they get there, if they didn't want to stay, or I guess they looked a particular way, they didn't keep them. They let them go.
Right.
And I don't know if it's.
And
I'm sorry. Go ahead, Jamie.
and I'm not gonna say look a particular way because sometimes if you can just wait a few minutes,
Right.
it'll come out. So we never rush a crisis. I
Right.
may talk to an individual for 30 minutes, and at 32 minutes, everything they were saying comes out because I am the president of the United States and I was just waiting. But I've talked to you for 30 good minutes and you've been coherent and said everything that you think I want to hear.
Hmm.
So it's very important for us not to ever rush the crisis and
Right.
just listen to the individual because the symptoms are going to present.
Sweet.
Wow. So what does that look like when you come out to assess somebody? Like, what are you doing? What are you asking them? Like a set of questions? Like, How do you determine that?
So it varies. I may ask them today's date, what year it is it, who's the president. And I've actually got to the point where the team has where we mix the questions up because if it's someone one that we see frequently, they memorize these questions. So they know what to tell us. So I may say something like, hey, what was the last holiday? Or what did you eat for lunch last week?
Mhm.
Something of that nature. So just to kind of, and it's like, if I have to think about it, it we may can see that there may be some symptoms there for us to look a little bit closer into. If it's June, May, and they're telling me the last holiday was Christmas, well, I
Right.
know they're not coherent. But
Yeah.
if I ask them what today's date is, because that's something that they're able to look at their watch and see that today is Thursday. So I'm gonna say it's Thursday, and AMR does not have mental health training, so they ask these questions in the same order. So they memorize the same order and
Okay.
they know how to answer.
All right. With this being Mental Health Awareness Month, like I said, we're going to kind of be discussing different topics throughout the month. But I think I may have seen that you may be somewhere or a part of something that's coming up. And some people may not know that there's actually mental health awareness events going on or events going on centered around mental health awareness. Would you like to share the one that you'll be at or some that you may know of so people can know that there's going on?
Sure. So, well, as far as mobile crisis is concerned, we're doing a Crisis Connect meeting. We hold a Crisis Connect meeting every other month, and it's open to the community because we want to just engage, first of all, and provide the information and let the community know that, hey, we're here. That if your loved one is having a mental health emergency, you don't have to call 911. You can call us. You don't have to wait till 8 o'clock a.m. because we're 24 hours. So you can call us at 2 o'clock in the morning when it's raining outside. We're coming. Um, so that Crisis Connect is just to engage and say, hey, what do you all need from us, and what we can provide for you all. Um, so that's what our Crisis Connect is.
Yeah.
Right.
I love that. I do have a question. So I know you said that, y'all come out, y'all assess the crisis situation. If you feel like the person is not coherent, maybe they've gotten off their meds or whatever the situation is, you say that y'all will then take them in. So when you're taking
Right.
them in, is it AMR taking them in? Is it that CRT? And what does CRT stand for too? So
CIT.
yeah, CRT.
So CIT stands for Crisis Intervention Officer.
Okay. Okay.
And so right now, I can say in Hinds County, every police department has crisis intervention officers, which is awesome for us.
Okay.
The CIT officers will transport. AMR will transport also. Mobile crisis will transport, and we also use their family support. So if the family is willing to support to transport, that's awesome. Sometimes the family is a trigger, and we want to remove the family from the situation. So
Right.
you know, if it takes me transporting to ensure that you get there, that's what we do. We have single point of interest entries, and we use CSU, Merit Health, UMC, and we're working on a partnership with VA Hospital now.
Okay.
Right. It's
Awesome.
good to know. Working in mental health, the three of us have worked at the same agency before, and I can say that sometimes that those families do have to be removed because they are the
Mhm.
trigger. And just if it's anybody online, if you just happen to have a question, you can type it in as a comment on Facebook or YouTube, and it will come up. And while we got Miss Jamie on the phone, she may be able to speak to what you asked. And Jamie, just to let you know, just you being here today has been extremely helpful. We have a college classmate that's on, and he's already stated that he stays in North Mississippi. He's already stated that he didn't know about 988, so he's learned something today, teacher.
Wow.
That's awesome.
I'm glad. I'm glad.
Now I do want to know when y'all getting the people transported in for these crisis situations, what does that look like? Like, do they stay in the hospital for a long time, or is there like a time frame that they're in the hospital, to try to get the crisis under control, or is somebody communicating with the family, letting them know like what's going on while they're there, or what?
So each crisis is different. It may be a situation where this person needs to be stabilized and they're there 2 days, and this person may be a little bit worse off and needs more help.
Mhm.
We want to eliminate in the state of Mississippi. Our goal now is to eliminate long-term treatment. So we don't want to send your loved ones to the state hospital. Like, we know they used to go and be there for months or years at a time. That's not our primary goal. We want to stabilize and help the individual stay in the community. Uh, so it just depends on what that care looks like when they get inside the hospital. Now, with mobile crisis, we are in contact with whatever facility they go to. We do a 24-hour follow up, a 72-hour follow up, and we continue to follow up to engage them in services. We don't communicate with the family if a release is not signed because the consumer has full autonomy. So if they tell me, listen, when you leave here, you can't say nothing to my sister, the sister can't get any information from me. And that's difficult because sometimes we can't make the family understand that they have rights too, but they do, and we have to respect it.
Yeah,
Mm.
that's big. That's really big.
Just another little nugget I like to throw out there for anybody that may hear the podcast. I remember when I was in mental health and I had used to have to go out to do home visits. I just want to let y'all know that if y'all ever in a situation where somebody is experiencing some type of mental health uh,
About 10
situation or exhibiting some type of behaviors, to just make sure you always making a way of escape. I just remember walking in this house one time and I was going to see a young man. And when I walked into the living room, I couldn't get out of the room that I was in. I would have had to go through him. And he just started asking he started asking questions that I knew that he wasn't coherent. They didn't make sense. And his mom walked past and she looked at me like, she bucked her eyes. She was like, "Oh, buddy, you in for a treat." And so, I just kind of held conversation with him to keep him engaged, even though he was, talking oddly. And even when I got to my vehicle, I was grateful to have the kind of cars we have now, where you can unlock with your little fob. Because I unlocked the door, and when I opened my door to get in, I could tell he was trying to get on the passenger side of my car, so he was trying to ride with me. So of course I I unlocked it and then locked it, and then I just kind of talked to him, And at the time we didn't have that crisis unit. I don't remember what I did, but I realized in that moment, don't let them get between, don't let them box me in. But it can slip your mind. But it's something that you really, really have to have at the forefront of your mind. Because if he'd have been worse off than he was, that could have been all bad.
Yeah. Go ahead,
And
Jamie.
so I responded to countless crises, and have responded several times with individuals inside of vehicles. I've never thought that, hey, someone can use a vehicle as a weapon, and it's like, hey, it's a car. Well, on February 16th, we responded to a call at Merit Health. Um, Individual we had responded to several times. He was in crisis. He was clearly incoherent. He was delusional, responding to hallucinations. Uh, Merit Health had in turn called Jackson Police Department. CIT officer responded. They called us. When we got there, the individual made the comment that, hey, I'm ready to go to the morgue.
Mm.
That's what he told the CIT officer. So when we got there, it was myself and two other crisis team members. The CIT, we were walking towards his vehicle, and the
Mhm.
CIT officer said, he said he wants to go to the morgue. And so I paused and I said, wait, what? And he said, well, he said he's ready to go to the morgue. So I said, hold on, y'all. And I called his name. One, because I wanted him to hear my voice, hoping that it would kind of bring him back to reality.
Mhm.
It did just the opposite. He put his car in reverse, then in drive, and he actually hit the CIT officer.
Wow.
He swerved to hit us. And so I was injured as well, tore my Achilles. The officer actually had about 12 staples in the top of his head. He was unconscious for some time. And I mean, the situation just went bad. And again, this is somebody we have responded to several times, has never been aggressive with us. So I'm saying it to say you never know what to expect. So you
Never.
always have to just, be mindful of what's going on. he actually turned the vehicle around to come back at us, and JPD had to release fire, which it was just like a whole situation. I thank God they were CIT officers who did not make contact with him, but then shot the tires out because they knew that he was having a mental health emergency. So every crisis is different.
Wow.
And I want to put this up real quick. Do you want to speak to that real quick before I put this question up, Ty?
Yeah, I just think that you just never think about a person being in a crisis situation and a car being used, in that situation, because usually you're coming out to a house or just somewhere in a community where a person is usually they're ambulatory. You know what I'm saying? They're walking on feet. So I just, just hearing that, thank God that you guys are okay. And yeah, that's a tough situation to be in. So definitely a big salute to you all,
Yeah.
just even being in a position that you're in to go out, because just like with police officers and like that particular police officer and yourself, you all put yourselves in harm's way to try to de-escalate, people harming themselves or other people. So definitely, I definitely salute you all for that.
All right. Here's a question from Naya. Can anyone call the crisis hotline during a suspected mental health crisis, or do they have to have been previously diagnosed with a mental health condition?
No, anyone can call the crisis line. They do not have to have a diagnosis. They do not have to be a current client with Hines Behavioral Health Service. It can be anyone who is in need. Anyone.
All right. And she said, we appreciate your service. Have another question. Well, there's a
This is
viewer named Anthony Johns. He said, I'm the officer who was hit that day. Miss Evans is truly awesome, man. Thank you
we're
for tuning in today, Mr. Johnson.
in and comment, and I definitely salute you as well just for your service. Again, you guys put yourselves in harm's way to help us as the community,
Wow.
when we're in a crisis situation. And I think even back to the previous question, if you haven't previously had a diagnosis of a mental health condition, at any point, Jamie, would you concur that any of us could have a mental health crisis?
Any of us. Right now, I think the statistics are eight out of 10 have
Mhm.
been diagnosed or go undiagnosed. And
Yeah.
this is when the crisis occur because things happen and we don't understand
Right.
what's going on.
Mm.
And two, to speak to the stigma associated with mental illness, someone who has a diagnosis is more likely to be hurt or killed by someone who does not, because we're afraid of them. We're afraid of someone with mental illness. We're afraid that they're going to hurt us because they have a weapon. When our actuality, they have a weapon to protect themselves.
Mhm. One thing that I will add to that, if you're someone who feel like you're struggling with depression, psychotic thoughts, whatever you think you're dealing with, if you think that or believe that, get help. And the reason why I say that, because I once was a case manager for an individual who was, I would say, very high class at one point. He shared some stories with me where he was with some very, very famous people in and out of the country, well-known people across the globe. And some of his friends that he shared with me were people that we seen on TV. I'll go as far as saying famous newscasters. This was his circle. And when he first started dealing with particular things, they convinced him it was nothing wrong with him. Oh man, you okay? It ain't nothing wrong with you. And because these were such elite people that were recognized by people around the globe, he kind of took his friends' advice, so to speak. Well, maybe I am okay. Maybe there is nothing wrong with me. And by the time he was even a school professor, by the time that I got him, I just watched him decline so much in that short time frame from being able to hold a good conversation with me and even correct me with certain verbs like the professor used to come out of it. And then next thing I know, he's not able to get out of bed. It just went downhill quick. And then I heard that he was deceased. So don't let nobody tell you, especially someone without a medical profession, Don't
Yeah.
let nobody just because you love them tell you it's nothing wrong with you. If you feel like you need help, seek help and let a mental health professional diagnose you, do a, what is it called? Do an assessment and then
Right.
go from there.
Mhm.
Right, because mental health isn't it doesn't have a certain color or creed. It's not a black thing. It's not a white thing. It's a thing, that we need to take hold to, and something that the community has to be informed about.
Yeah. Is there anything or any advice that you would give to like uh just the viewers watching that may be wondering like what should I do if I feel like, either I am, having a mental health crisis or, I have a family member that's just refusing, to get mental health care. Is it any advice that you would give them as to what steps to take?
Well, I'm going to say education is key. If you need some answers, call. You can call the crisis line. You can call me personally. Whatever information or guidance I can offer, I will. Uh, as far as if you are in crisis and feel like you're needing assistance, please get help. Please get help. Don't worry about the stigma associated to mental illness. Just like people get assistance or help, they go to a physician if they have cancer, if diabetes, we get treated for that. We need to get treated for mental illness, mental health as well. Our mental health is very important and very key, and I think it's overlooked so much, because of the stigma associated with
Yeah.
it. It was a time when you heard someone had HIV, you would pretty much turn the corner and didn't want to deal with them. We do that same thing with mental health every day now. And if you hear somebody say that they have HIV, it's like, oh, okay. But if you hear somebody say, I have a mental illness, we want to kind of give them a side eye like, oh, it's the worst thing in the world. And it is not. It is not. People function every day with mental health conditions, and you can function with
I have also one other question for you, Jamie. Like I know when I worked in mental health, I had one particular client where there were easy telltale signs for me to identify when he was going or sliding into a mental health crisis or he was non-compliant with like his medication. One thing that I noticed about him was when I first met him and I went out to do like, my introductory visit and everything and do all of my treatment planning and all of these things that you do, when you're working in the field. I remember meeting him and he was very, very small. He was skinny. And I remember going on into the to get myself blocked in, like DeMarco had mentioned earlier. I knew not to like let myself get blocked in where I couldn't make a smooth exit. But at one
it.
point, as I began to talk to him, because I had never seen him before, I didn't know what he was supposed to look like. But as I started talking to him, I started hearing a noise. And I was like, can you repeat that? I'm sorry, what did you say? And he made it again, and it was clear as day. He was growling like a dog, you know. And I was like, okay, something is not right here. And so I got up and I told him, I said, you know what? I sit down so much driving, that I need to stretch my legs and I'm just going to stand up or whatever. And I was like, and he kind of continued to growl at me. And I was like, I know in those situations you have to remain calm. And I just told him, I appreciate his time. I'll come back and visit with him again soon. And I made my exit and I left. But when I went out to see him again after he had been committed to the state hospital for a while, I went to the home and I asked for him. And when the man opened the door, and I asked for him, he was like, "This me." And I was like, "Huh?" But he was heavy set, his face and everything looked clear. He just looked like a total different person. And I was like, say what now? He was like, yeah, I remember you. And he remembered me. And I was like, you sure that's you? And he was like, yeah, come on in. I remember you came and I ended up having to go to the hospital because I wasn't well. And I was like, oh my God. So it's almost like he had gained like 100 pounds from, our first interaction with each other. So that
Yeah,
ended being a sign for me to know if I ever go and see him and he's starting to lose weight, he
right,
might
right.
be, off his meds or whatever. So is it any other signs that you would say a person can identify when a family member or friend or somebody may have started to become non-compliant?
I would say when they begin isolating themselves, that's a key factor. If they start isolating themselves from family or friends, and you can watch what you know that they are normally like, anything out of the ordinary. Sometimes we see where they'll start giving things away or they become extremely manic. Watch for those signs because those are signs that something is going on or is about to go on, and we want to get ahead of it.
Yeah. What is manic? What does that mean?
Oh wow! So manic is a situation when, man,
Like I
I guess
know,
the best way for me to explain it is when you're just rolling. Like they get in and they're hyper, they're hyper with everything. Sometimes you may get it where they're hyper religious or they're gambling uncontrollably, or sometimes with mania they get very sexually active. So it just depends on how the manic behavior is affecting that person. Sometimes with mania, they are talking 90 going nothing, and nothing is making sense because their thoughts they're not even truly thoughts, but they are not even completing their thoughts.
Right.
yeah, wow, yeah. That's good. I really, really appreciate all that information because I think it's vital for people to know. Yeah.
And I agree. We've had several people on the comments to just say that they didn't know some of these things, and we had a brother that even come in and say, that could be scary. Just even though we're conversing about this, so if it's scary listening to it on the line, imagine what it could be when you're present and you're in that moment.
Yeah.
Right.
Yeah. Just like Jamie told it, somebody that they had never seen a particular behavior out of before exhibited that behavior and it became dangerous and it wasn't the norm. So yeah.
Awesome. I appreciate you, Jamie. You got anything else you want to share with the people?
Nothing other than our mobile crisis number, which is 601-955-6381. Again, that number is 24 hours, 7 days a week, 365 days a year, and we respond to all of Hinds County. If you need us, please give us a call. And of course, 988. If you can't remember the 955 number, just tell them you need the mobile crisis team in Hinds County. Each county has a mobile crisis response team, so don't let them tell you they don't.
All right. Yeah, and just like she said, I just want to reiterate what she said earlier. We all know 911. Just turn those ones to 8s, 988.
Exactly.
Yeah. You got a lot of people telling you thank you for the information and thanks for all you do. So, and we definitely echo it because everybody is not. It takes special people to work in circumstances and situations, and everybody is not up to that challenge. So I really, really appreciate you and everything that you're doing for the citizens in and around Hinds County. Yeah.
Agreed. And with
Yeah.
those that they put up, it's ones that we cannot put up just on Instagram Live, but we have a brother way in Carson, California, Ronze Drew. He said, thank you, Jamie. And yeah, we have
Thank
brother Brian's Reynolds and Jackson is saying he's gave some emojis. So your information has reached, I think Robert Isaac maybe in Memphis or North Mississippi and California. So your knowledge bless people in multiple states today. So we appreciate you.
Yeah,
Thank
definitely.
you all so much. Thank y'all for having me.
Yeah, and y'all remember that 988 is not just for Mississippi. We're nationwide. So just dial 988 if you feel like you're in a crisis situation or someone that you're near, around, or a loved one. So yeah.
All right. And Jamie, don't go nowhere yet, but to everyone else, this has been another episode of Facts and Feelings. Tune in next week. We're going to have something else for Mental Health Awareness Month. We thank y'all for tuning in. It's your boy Twice.
It's your girl Kay.
We are holla.
I wonder if it's facts or feelings that you're feeling. I don't know if you know what's for real. Baby, just relax and chill. Let the tea spill. I bet the chemistry stop the pill. I wonder if it's facts or feelings. feelings.